Namaskar. Welcome again to Ask Dr. Gupta. Cancer, a deadly disease, a dangerous word. It is something which is dreaded by patients, by society, and by doctors also. And it is deservingly dreaded. For many people, if not most, cancer is like a ghost. They don't know much about it, but fear it. Like in case of ghosts, we do not know how do they look like, why they attack, and how to get rid of them, whom to approach. Similarly, in case of cancer, most of the people do not know what cancer exactly is, what are the risk factors, and who is the right person to approach it to get it treated. Finally, in both these situations, people end up reaching wrong people. They spend money, I will say they waste money and don't get benefits also. So, today we shall try to demystify this ghost analog called cancer. The literal meaning of cancer is a sea animal that looks like this. You will find this animal in logos of many of the organizations which are treating cancer or are supporting cancer patients. The crab destroys its prey by nibbling. Similarly, cancer also destroys the body of this victim by slow destruction. So these two are similar. Cancer is caused by imbalance between cell death and cell replacement. Whenever a person is born, he or she is born with some cells. These cells, except some cells like nervous system, they keep on dying. They have a finite age. They die at the end of that age and are replaced by new cells. The balance between this cell death and cell growth is very delicate and it is maintained in every part of the body very finely. Sometimes, because of many reasons, this balance gets disturbed and more cells start growing than necessary to replace the dying cells. This leads to accumulation of these cells. This accumulation makes a mass because these cells are extra. This mass grows in an uncontrolled way because these are the cells which have not followed the normal cycle of cell birth and cell death. So, this is what a cancer nodule becomes. These extra cells will suck nutrition and energy from the food the host is taking. The patient will get depleted of energy and nutrition while the cancer will keep on growing. So, this is what is cancer. Later on, these cells break from their original site of origin and they get deposited in other parts of body like lungs, like liver, like bones, like brain. This is what cancer spread is all about. So, cancer can be broadly equated with a worm in your intestine who eats up all the food that you are taking. So, the host gets depleted and the worms keep on proliferating and growing. You also must have heard about worm eggs going to brain and causing convulsions, but there is a big difference between a worm and a cancer. That worms are very easy to treat, but cancer is very difficult to treat. Another difference is that worm is a parasite which has come from outside, but cancer cells actually originate from our own body. So they are very similar to our normal body cells. Because of this reason, whichever treatment is given to kill cancer will also harm the body because the cells are similar. They have originated from our own body cells. Unfortunately, cancer carries a stigma. Anybody whose health is going down steadily is taken to be suffering either from tuberculosis or from cancer. Interestingly, both the diseases are treatable, they are curable, and to some extent preventable. The stigma is so bad that people avoid sharing room with the victim of these diseases. They avoid sharing utensils with these diseases with these disease victims. But the fact is that cancer is not contagious. Even in case of tuberculosis, which is actually contagious, the concept of isolation and the concept of sanatorium has been done away with. There is a nihilistic thinking in case of cancer. People avoid treatment with a mistaken belief that there is no point getting treated because this is incurable disease and any effort is a waste of money and waste of energy. Death is taken as sure shot. Everyone who has got cancer will die a painful and slow death is an assumption which is unfortunately very prevalent. The most unfortunate part, something which I actually find sad, is when a doctor says this. I have seen many doctors, of course, non cancer specialists, who tell their patients that no patient of cancer gets well. So take him home, keep him happy, don't waste money. This is very, very unfortunate because the statistics and the facts they suggest otherwise. There are many beliefs, many misconceptions which have become so deeply planted that I like to call them superstitions. One such superstition is that handling of a cancer leads to spread, leads to dissemination. So do not get cancer sampled. Don't get a FNAC done, don't get a biopsy done, don't get a surgery done. While the reality is exactly opposite. When a cancer tissue is sampled, then the treating doctor gets detailed information, essential information about the exact nature of the disease, and is also very helpful in giving us guidance about the treatment that should be offering to the patient. Everybody in the world who has been cured of cancer, and the number is in tens of millions, everybody has been able to achieve this feat only after getting the tissue sampled and getting detailed information. There are instances when people quote that somebody around them got the disease progression after biopsy. Then actually this disease progression was because of natural course of disease, and treatment was not offered after biopsy. The disease has grown because of its nature, and the blame was put on biopsy, while the actual reason was denial of treatment. Many a times sad situation arises when a family refuses surgery under this misconception that surgery will lead to dissemination, while in solid malignancies we all know that surgery is among the most effective treatments. So they refuse treatment, they refuse surgery, they go, and the patient who could have been cured is left to die a slow, a protracted, a painful death. Many a times these patients come to casualty some months later in a very bad shape. At that time, most of the time, the families apologize. With folded hands, they touch our feet and they say that, sir, we committed a mistake. We got carried away by the rumors. So please operate us now. We have understood that we were wrong. But at that time, the disease has progressed enormously and the patient is depleted. At that time, curative treatment is generally not possible. So a precious life that could have been saved is lost because of these misconceptions. So do not fall for rumors. A specialist knows best. A specialist knows better than hearsay. So trust him. Second misconception, which is again almost a superstition, that there are so many side effects in treatment that it is better to leave the patient to die untreated instead of getting treatment, particularly chemotherapy. The most dreaded side effect of chemotherapy is alopecia, that is hair loss. For us, this is relatively less severe side effect because number one, this is reversible. The hair come back when the treatment stops. Number two, the solution is very simple. You go to market, get a wig, and you will be having similar look that you had before treatment till your natural hair come back. And one important thing to understand is that effect and side effects go hand in hand. They are just two sides of the same coin. Even the medicines taken for common cold, the simple painkillers also, they have side effects. So if we want to get the benefits of effects, then we should be mentally prepared to tolerate the side effects also. In case of cancer, the side effects are relatively more because the cells that are being targeted are actually variant of our normal body cells. They are very similar to our normal body cells. But one thing is to be understood by every patient of every disease, that treatment is offered only when a doctor feels that the potential benefits actually outweigh the risks. The side effects are temporary, and these temporary side effects might give you permanent riddance from a deadly disease, from a dangerous disease. So I will repeat, do not fall for rumors. A specialist knows better than hearsay. Trust him. Third misconception is that costlier the treatment, better the results. In other words, the treatments are prohibitively expensive. You cannot get your beloved person cured unless you have truckloads of money. That reality is not concordant with this. It is exactly the opposite. As a rule, best medicines are given first in any disease, in any treatment. And those medicines which have been most extensively tested and have established efficacy are generally out of patent, so their cost is not very high. The medicines which are costly are actually newer ones whose final benefits are yet to be conclusively established, and they are given in second line or third line. Incremental benefits are generally not proportionate to the increase in cost. Still, if you find that the treatment being offered is out of your financial capability, then please talk to your doctor. It is better to take a less costly treatment than to deny the treatment benefit at all. There are misconceptions about surgery and radiotherapy also that I will discuss in subsequent discussions. But one thing I would like to say at the conclusion of this discussion, that never ever think that your beloved one would have been alive had you been a rich person if you had more money. This is almost never true. Go to a specialist, follow his advice, and do not fall for rumors. With these words, I will wish all those getting treated for cancer a very happy recovery and everyone a very healthy and a long life. Namaskar. Thank you.